Unity Hospital in Fridley has been named one of Minnesota's 4 Ebola treatment centers, and they have been working nonstop to prepare for any potential patients.
Training at Unity has been extensive as they put policies and procedures in place with guidance from the CDC and the Minnesota Department of Health. If a possible Ebola patient is transferred to Unity, they will have a 2-hour notice to put their plan into action, which starts with a specialized arrival procedure.
The ambulance would arrive in our ambulance bay. Our team would be ready to prepare, or would be ready and prepared to receive them. They would be in the personal protective equipment, and we have a process where they would be immediately transported to one of our dedicated isolation rooms down in the emergency department.
The designated Ebola screening room in the emergency department is the closest room to the ambulance entrance. The room is also accessible via an adjacent room, which will mean staff will be able to enter the room without opening the door to the main hallway. If Unity is receiving a patient who has already tested positive for the disease, a different procedure will be put into action.
If we know we're receiving a patient who truly has and has been diagnosed with Ebola, we also have a process where they will transfer directly up into our isolation area, which is we've dedicated part of our intensive care unit for that purpose, so they will be completely isolated.
Dr. Kettler understands a certain level of apprehension in the community about the possibility of an Ebola patient being at the hospital, but he is confident that their isolation procedures will keep the patient completely separate from the rest of the hospital population. He also wants to reiterate that the disease is not airborne and is only contagious if symptoms are present.
As we know, an individual is not infectious unless they're having symptoms. And the symptoms are flu-like. So fever, headache, muscle aches, nausea, vomiting, diarrhea. And we also have to remember, most people who have those symptoms probably have the flu or influenza or some other thing. So we also have to be vigilant about looking at other things.
Unity is still waiting to receive more personal protective equipment as the demand for such gear is extremely high. But if a patient were to be transferred to Unity today, they would be ready and could quickly receive backup supplies from neighboring medical facilities. The other 3 Ebola treatment centers in Minnesota are Mayo Clinic in Rochester, Children's Hospital in St. Paul, and the University of Minnesota Medical Center in Minneapolis.